My name is Vitaliy Poylin. I'm a colorectal surgeon in Northwestern Medicine, and I'm a section director of colon and rectal surgery.
My name is Scott Strong. I'm a colorectal surgeon here at Northwestern Medicine, and I have the privilege of being the surgical director of the Digestive Health Center, as well as the chief of the Division of Gastrointestinal Surgery.
So there are a couple of things that I think are kind of newer and exciting. So first of all, there are a number of new medications that we have to deal with as surgeons as we transition people between different stages of treatment of inflammatory bowel disease. And having an outstanding team of gastroenterologists helps us quite a bit to kind of guide our patients through the process. At the same time, there are some newer surgical techniques. For example, there is a newer way of constructing the anastomosis in Crohn's disease. It's called a Kono-S anastomosis, named after Dr. Kono, who developed it in Japan. And it seems that at least short-term and intermediate data suggests that it may be better for patients with Crohn's and decreases recurrence. We do it here at Northwestern Medicine. For example, I do it, and Dr. Strong prefers a different way of doing it, and give us different perspective on the matter and provide different points of view so we can actually find whatever is best for patients.
And what we're trying to do is, as safely as possible, give our patients a relatively symptom-free lifestyle with a good quality of life. One of the things that's quite unique about Northwestern Medicine is that a lot of the health centers across the U.S. have come to understand that we have more in common with our GI colleagues than we do with an ear, nose, and throat doctor or an orthopedic surgeon, where historically those were all people that kind of congregated together. But at Northwestern Medicine, we actually see patients in the outpatient setting side by side with our GI colleagues. So our IBD gastroenterologists are in the office working with us. My exam rooms are right next to their exam rooms. The collaboration between the surgeon and the gastroenterologist and other ancillary personnel is so important and critical. And so dialogue and communication is the only way that these people really receive the care that they deserve. One of the things that's on the horizon and is being trialed in the U.S. is the use of these stem cells. And the stem cells are derived just from fatty tissue of a donor, and it doesn't have to be from the patient. But they have the potential of morphing, if you will, into a different type of cell type. And so in particular, in patients that have fistulas, which is a common kind of problem for patients with Crohn's disease, there may be some benefit to using these stem cells in that area to heal these fistulas. We also have some exciting things working with hyperbaric oxygen. And what we're finding is by increasing the amount of oxygen in the tissues, that we're having a response in our patients with ulcerative colitis that may have otherwise failed all kinds of medical therapy.
I think additionally, as we've been actually utilizing more robotic techniques on patients with inflammatory bowel disease, I think in the past couple of years really made a lot of progress. And definitely for me, some of the cases that I ended up making a bigger incision, now I can do with a smaller one because of a user robot. At the end of the day, it's still a tool. It just helps us get to a point that we need to get the patient to, but it can actually be quite beneficial in a lot of cases in Crohn's disease and doing some of these connections intracorporeally. We actually have a wider range of tools and techniques to kind of get patients to that point, get them out quicker, get them a better outcome. We provide a 360 approach to the care of inflammatory bowel disease, from the standard therapies to cutting edge newer techniques, as well as availability for research in the studies that may not be available anywhere else, with a team that's really dedicated just to that, but also dedicated to our patients and as well as referring providers. I think one of the huge advantages that we have here is outstanding all-around team that deals with inflammatory bowel disease. We have specialists in gastroenterology who do nothing but inflammatory bowel disease, as well as other specialties like dermatology, nutrition, who are particularly specifically dedicated to treatment of this disease. And the multidisciplinary approach for these chronic conditions is common, but I think we take it to the extreme of how specialized our teams are. That allows us really to provide comprehensive all-around care for our patients.